Hello, my name is Dr. Brandon Stephen Park, and thank you for coming today. Today we want to talk about diffusing power struggles. Something that's really important to me is as we're working with all of our clients, students, patients, one of the things that can easily happen is power struggles. Now, the things I'm going to be teaching you today is actually really good skills, whether it's a family member, a coworker, or in this case, it's going to be a student. We're really going to focus on power struggles that can happen between students and workers and those working with them and supporting them. But these skills can actually be used in multiple ways, with multiple settings, with anyone in your life. So the first thing I kind of want to talk about is this idea of what are power struggles. Well, power struggles are any time two parties are at odds with each other, obviously. Now, most of us think about active power struggles, and active power struggles are big fights and yelling and screaming matches, fist fights in worst case scenarios. But most power struggles aren't these big active ones. They're actually passive power struggles. So the difference between an active one versus a passive one is active is very out in the open. It's very visible to anyone who's there, such as a screaming match or a yelling match. But passive power struggles are much more subtle. They're things like ignoring people, ignoring rules, purposely pouting or showing emotions to try to affect how someone feels or manipulate them, making accusations that are untrue. It's doing things to kind of undermine the process in an indirect fashion. So maybe they're called passive power struggles. Indirect power struggles might be a better term for it. But any way that someone's trying to grapple with and deal with somebody in a way that is not obvious, public, and direct. Politicians are really good at this. So are a lot of adolescents. I think I may have been very good at it at one point in my life. These are ways that we try to get what we want in indirect forms and fashions. And these are things we kind of got to watch out for, because they eventually will lead to active power struggles and can sometimes also lead to events requiring, de-escalation and other kind of interventions where we really don't want to get involved in. So let's kind of talk a little bit more about some of this. One of the first things that you want to try to establish, if possible, is can you form a sense of cooperation with somebody? Can you kind of get together with somebody to kind of work out? And one of the ways I always like to do is just say, hey, I can see that there's something going on here. Acknowledge what's happening and say, I'd like to see if we can work on something where we both walk out happy, or win-win solutions. So work on cooperation, work on trying to figure things out, work on being on their side. Like, hey, I can tell you're struggling. Let's see if we can figure this out. Let's see if we can find a solution to this problem. Because then, rather than being an adversary, you're suddenly working with them. So kind of always think about it from this standpoint. Are you looking straight at them and in opposition with them, or are you kind of working next to them hand in hand? Because when you're working with them hand in hand, then you're trying to actually solve a problem together. So if you can first try this approach of acknowledging that you see there's something there and saying, hey, I want to work with you to see if we can come up with a solution or find a way we can work together on this, then that's this idea of cooperation. It is working together. And right away, when someone feels like you're working with them, not against them, it changes the whole dynamic. It takes the power struggle away. It really diffuses that element of aggression and frustration. Along with this, we want to make sure that you're validating their distress. When I'm talking to our students, I always want to let them know, like, hey, I want to work with you on this. Let's see what's going on. And I can really understand how hard this is. We want to make sure that these kids feel validated, seen, and understood. If you are coming in from wherever you lived before and in a residential treatment setting, that can be hard. You may have great friends and great staff and all kinds of wonderful activities and things you get to do. But when you're not at home and you're trying to work on things that can be hard and difficult, it can be really difficult. It can be painful and problematic. One of the things I always like to say is, if you had to be in Disneyland and that's where you had to stay, at first it'd be awesome. But after a while, it would feel like you're really locked in. Even Disneyland would become a very unfun place if you didn't feel like you could get out of there and go explore things. So really acknowledging that this is hard for these kids, missing home, missing family, missing friends, missing their pets. Acknowledge those things, connect with them, validate those things. Helps them to feel seen and heard and cared for. One of the things that I loved the other day is I was sitting down talking with students during a group therapy session, and several of our kids had been at different programs, and then I started talking to them about how this can be hard. Several of my kids piped up and said, this program's so much better than some of the places we've been before. And I said, why? And they said, well, it's because the staff listen to us. They actually care about us, and they know that we're going through a tough time. That really warmed my heart, made me so happy to hear, because this can be hard, this can be tough. But when someone acknowledges that and can see you and you feel heard, it can change everything. One of the next things I really want to get across is the first step of ask. What is it that's going on? Why are you hurting? Why are you struggling? Why are you frustrated? I was working at a hospital one time, and at the hospital, there was a young woman who had refused to take her medications. Now, she was legally sanctioned to be there, and if someone doesn't take their medications, we were required by law, I didn't agree with this, but we're required by law to give them an injection. And so I didn't want to have to give this patient an injection. But I walk in the door and everyone's putting gloves on, and I was stressed out. I was like, well, okay, this sucks. What can we do differently? And so I said, wait, everybody, give me just a minute. Let's find out what's going on with this patient. Now we'll give her the name Dolores. So I go out to Dolores and I said, hey, Dolores, let's talk. And I sat down right next to her. She was sitting on the floor. So one thing I did that was very important was I got down to her same level. So I wouldn't stand over top of her looking down at her. I actually sat down next to her and made it really kind of a comfortable situation. Just said, hey, what's going on? I just wanted to check in with you. And she kind of avoided things at first, but as I kind of kept talking with her and joked with her a little bit, finally Dolores looked at me and she just said, you know, my auntie, who we've grown up together like sisters, someone just let me know that she died. None of the staff knew that because she'd found out on a phone call. But that changes everything. She wasn't not taking her meds to be mean or spiteful. She was emotionally struggling. Sometimes if we just take the time to ask, what are you going through? And really get down on their level when you're doing it and take time. And you might have to ask multiple times to get to it. You might have to even help them kind of solve some questions in their head that they can't quite solve themselves. But take time to ask. Find out, why are you hurting? Why are you frustrated? Where are things going? When you do that, you open up so many chances and opportunities to solve the problem together as a team. And that takes away, again, that power struggle. Another thing that I think is really important when you're helping people that are in these different situations is to give people options. It was really interesting. I was working with someone who'd worked in a prison, and one of the things they decided to do in the prison was to try to give options and choices. Now, they were very small options because there wasn't a lot available, but just simple things like, hey, do you want to take your shower now or in 5 minutes? Do you want to do this activity or this activity? And most of the time, they were choices where it was really focused on what was available, but just giving small choices rather than giving directions of what they had to do changed the dynamic. In that prison where they did that, suddenly there was less violence, there was less aggression, there was more commonality and positivity that was going on just by the prison guards taking time to give some choices. Well, I worked at a state hospital and we took that to heart, and I worked with the hospital on team building and changing, kind of how we focused on things, and with using techniques in positive reinforcement and diffusing power struggles, which included giving options and choices to the patients that were there, we saw a dramatic change. We saw a 20% reduction in violence, a 30% improvement in patient satisfaction, and a 40% improvement in staff satisfaction. We also saw patients being able to discharge sooner, just from using positive reinforcement and diffusing power struggle techniques. That's all we did. really getting people to buy into them and really believe in them. So power struggles are normal. They're part of daily life. There's always going to be someone who sees the world differently than you. You see the world differently than them. But if you can take time to try to find ways to connect with that person, validate them, see where they're coming from, let them know that you see them. Try to figure out ways to cooperate with them, find ways to work together. Ask them what's going on, ask them sincere questions. And whenever possible, give them options, choices, help them to be part of the solution. Then suddenly the power struggles go away and you become part of a team. And that can make all the difference. And when you're working with students of any sort or form, or patients or clients, working together as a team is a heartwarming and a beautiful part of this process. Anyways, thank you all for your time and look forward to talking to you again soon.